Hey everybody, it's Kevin Kane, healthcare organizer at Citizen Action of Wisconsin, and I want to talk specifically about the Affordable Care Act and its impact on unions. Individuals who have employer coverage generally, usually through a collective bargaining agreement, really what this means for people who, are union members and have health care. So the good news is that overall, the Affordable Care Act doesn't do a ton to individuals who have health insurance. The main part of the Affordable Care Act was to help fix a huge inequity in the healthcare system, where tens of millions of Americans just did not have coverage, whereas costs were skyrocketing across the board, and this was impacting pretty much everybody, including those who did have healthcare coverage. Because when it comes to healthcare, we're all in this together, we're all impacted. Your decisions impact my healthcare, and my decisions impact your healthcare, which is why we needed to help fix healthcare and reform it across the board. But there are some impacts to union members, and so we wanted to make sure people understood what those were. First and foremost is the question of grandfathered plans. Basically, all the new protections that come in, will this impact our current healthcare plan? And what happens is, if you like the insurance you have now, there's not a requirement to change that. So if you have insurance, you like your insurance, that's fantastic. But there are new protections that are about to come in place, including some that originally came out when the law first passed. There are a few more that are going to come in place this year on January 1st, 2014. But if your plan started before then, or even before March 23rd, 2010, your plan is what they call grandfathered in. And so some of the protections around out-of-pocket costs, around premium costs, around protections such as those with pre-existing conditions, and many others don't necessarily have to be part of your plan, but new plans will have that. But overall, this law is supposed to impact the security of individuals. Basically, if you ever lost your job, wanted to leave and start a small business, or you got laid off, or perhaps your plant closed, and you had this period in which you didn't have health insurance from your employer, there now will be some place to go to get health insurance. This is the constituency that this law was supposed to help, the individuals who don't really have insurance now. And overall, we needed to address this, because here in Wisconsin, costs have been skyrocketing. Over the last 10 years, in Wisconsin, costs have doubled. That means twice as expensive as it was before, which is faster than the rising of wages, faster than the rising of most profits of small businesses especially, as well as tax burdens from local and state governments. So basically, by not impacting this, by not trying to reform healthcare, we were all paying more and more of it, even if we already were covered. And so one of the other ways that the Affordable Care Act really helps impact the future of large businesses, especially those that are part of union bargaining contracts, is for large employers there's going to be automatic enrollment. Basically, if you have 200 or more employees, whenever new people join the company, they will automatically be enrolled in the new plan that the employer offers, unless they opt out. It's to help make sure that people get in coverage right away and there's no lag time in between there, because we want to help make sure people are covered and they have some place to go to get coverage. Other changes include smaller things that you may have seen, such as waiting periods before you start to get coverage. For example, any plan that wants to have a waiting period of 90 days or more will no longer be allowed. And so this means that more people can get health insurance quicker when they start positions at new companies. Now, we've heard a lot about this topic of employer responsibility. Basically, employers have to offer some sort of health insurance plans to their employees if they're more than 50 employees. We've also heard a lot of attacks against this. This is somehow going to hurt our small businesses, hurt our large businesses, and impact people's ability to get health care and full-time jobs. Now, a lot of companies have attacked this law, saying that this is not the case. No matter what happens, though, no matter what they say, we argue that it's definitely not true, but they can't argue this for 2014 because this provision that employers have to offer some form of health insurance has been delayed until 2015. So any employer that tries to say they're being forced to do something and this is going to negatively impact you either through your bargaining or just the day-to-day operations is not the case, especially not for 2014. One of the other topics that's gotten a fair amount of discussion is this topic of the Cadillac tax or an excise tax on high-value plans. If you have a health insurance plan that costs about $10,200 for an individual or $27,500 for a family, there's going to be a higher excise tax on those plans. Now, we at Citizen Action agree with the idea of starting to look at things like high-valued Wall Street-style plans, but at the same time, we think that this level is too high. We think that it impacts people it wasn't supposed to impact, people who have bargained contracts, people who fought really hard for health insurance, and it shouldn't necessarily have to impact you. And so that's why we feel this law needs to be improved, but not repealed. A lot of efforts, especially discussions of this, are to repeal the law or get rid of it, or this is somehow one reason to get rid of it. This law is too important for the health, the safety, and the security of millions of individuals, both who have health insurance and who do not. Because you can't live the American dream if you do not have access to health care. If you don't know how you're going to be able to pay your bills and get the health care, how are you supposed to live your lives, work your job, feed your family, and move forward with your life if you don't have that security? And we know that you, union members, we know that you understand this. This is why unions have been on the forefront of fighting for health insurance for so long, because people need that security of knowing that they have some form of health insurance. And now, while many individuals currently have it, if you ever lost your job or lost some of your health and benefits at any point, this law means that you will have some place to go. And for many individuals, they'll be able to get health insurance for the first time. These gains are far too important for us to scrap the Affordable Care Act. So we need to be working to make it better. We need to be working to improve the law both at the state level and at the federal level, which means that we need you to join us to stay involved in this fight, because this law, again, is way too important for us to scrap, but we need to improve those particular areas. So where we need to improve this law, how do we talk about it? We encourage you to contact us for this information. We encourage you to work with us to figure out how to get the word out. And thank you so much for watching this video. You can contact us with the contact info below.